Hello, and welcome to the next MSAG lesson where we continue to explore COVID-19 through a new lens. Today, we want to consider the contrasting viewpoints that exist on the handling of the pandemic to help you prepare for your medical school interviews. Interviewers will often ask you for your opinion on this topic, but besides and before your personal opinion, they're interested to find out if you can appreciate and discuss other people's perspectives. It might be helpful to have a pen and paper handy so you can take some notes as you go along. There are endless opinions about how the pandemic should be managed. This is being a uniquely challenging situation for governments around the world. There are curfews, quarantines, and other restrictions in place in many countries with the hope of reducing the spread of COVID-19. According to a Euronews report, around half of the world's total population was under lockdown in April 2020. With nearly 4 billion people facing some form of lockdown in more than 90 countries, there's bound to be disagreement about the best way through this pandemic. All of you watching this video will have your own opinions on what should or should not be done to handle the pandemic, but when considering hot topics, it's always important to think about both sides of the argument. In this series, we're going to explore two viewpoints around COVID-19 in detail. The first viewpoint is that safety should be the utmost priority, and the spread should be stopped by all means necessary. The contrasting viewpoint is that freedom, the right of movement, the right to work should be prioritized. In this lesson, we'll explore the argument of those who favor measures such as lockdown and increased restrictions. In a following lesson, we'll explore the opposing arguments as well. Why don't you try thinking about some of the arguments in favor of prioritizing a reduced transmission and in favor of implementing lockdowns? Pause the video and jot down a few ideas before watching more. Argument 1. The transmission rate. The first argument in favor of prioritizing restrictive measures is because the transmission rate of COVID-19 is high. In public health, the transmission rate is measured using something called the reproduction number, or R number, which is the average number of people infected by a person with the virus. If the R number is greater than 1, an epidemic in general is seen to be growing. If the R number is less than 1, then an epidemic is shrinking. According to the European Centre for Disease Prevention and Control, one person infected with COVID-19 will, on average, infect between 2 and 3 other people. A typical influenza virus, also known as the flu virus, has an R number of 1.3. This means that the average person who has the common flu will infect 1.3 other people, whereas an average person with COVID-19 will infect 2 to 3 other people. A new variant of COVID-19 was identified in the United Kingdom, predominantly in the south and east of England. This variant includes a mutation in the spike protein. Changes in this part of the spike protein may result in the virus becoming more infectious and spreading more easily between people. The UK Prime Minister, Boris Johnson, said that this new strain is up to 70% more transmissible. As this variant was only first discovered at very low levels in September 2020, at this time, there is limited reliable data available. If we look at data from the UK government on the number of daily positive COVID-19 cases from September 2020 until mid-December 2020, you can see that daily cases have increased significantly. This new variant, which is thought to have a higher transmission rate, is partly responsible for this increase. You could make an argument that safety should be prioritized to stop this new strain of COVID-19 spreading throughout the UK and the rest of the world. What about medicines? Can't they be used to reduce the transmission rate? There are currently no medications to stop people from catching COVID-19. Vaccines have been developed, but it will take a long time to effectively vaccinate an entire population. Therefore, it can be argued that we must use non-pharmacological options to stop the virus from spreading. This includes strategies such as physical distancing, hygiene, masks, isolation of infected people and their contacts, and lockdowns, such as the closures of school and businesses and bans on public gatherings and travel. Argument number 2. The fatality rate. The second argument in favor of prioritizing restrictions is because the mortality rate of COVID-19 is higher than that of other common contagious diseases, such as the common flu. The fatality rate is the proportion of people who die from a specified disease out of all of the individuals that were diagnosed with it over a certain period of time. The fatality rate of COVID-19 is difficult to assess. The World Health Organization estimates that the global crude mortality rate is between 3 and 4%. The real mortality rate is likely to be lower, as this will not take into account cases where individuals are infected with COVID-19 but do not test positive. However, the mortality rate of COVID-19 is still thought to be much higher than the common influenza, which has an average mortality rate well below 0.1%. There is currently no cure for COVID-19. Given the fatality rate of COVID-19, many people argue that safety should be prioritized and that lockdowns should be used until we have other tools, such as treatments and vaccines, readily available. Argument number 3. Lockdowns work. The third argument in favor of prioritizing restrictions is that lockdowns have been shown to work. There is evidence demonstrating the effectiveness of lockdowns in data from the 1918 Spanish flu as well as the COVID-19 pandemic. In 1918, the world faced another pandemic called the Spanish flu, which infected 500 million people with an estimated death toll of between 17 and 50 million people. Why is this relevant to the COVID-19 pandemic, which happened 101 years later? Historical data, which was analyzed from 43 cities in the United States during the 1918 to 1919 Spanish flu pandemic, shows strong evidence that lockdowns reduce death rates, as well as the total number of deaths. As historical data shows us that lockdowns may be one of the most effective tools that we have in preventing the spread of COVID-19, you can argue that they should be used at least until we have a better alternative. We don't only have historical data, we also have more recent data. Let's look at this data from the UK government showing us the number of positive daily COVID-19 cases from the 1st of March to the 10th of June 2020. You can see that COVID-19 cases rose rapidly in March. The UK government implemented its first national lockdown on the 26th of March. As you can see, the number of daily cases of COVID-19 plateaued and then decreased. This is further recent evidence of the effectiveness of lockdowns. The Health Foundation reported that countries that were the most stringent in taking steps to slow transmission generally had lower death rates. Argument number 4. Prioritizing safety is the morally correct thing to do. The fourth argument in favor of prioritizing safety and lockdowns is that it's the morally correct thing to do. COVID-19 can affect anyone, but is more dangerous to certain groups of people. COVID-19 is more likely to cause serious illness or death in people over 60 years old, as well as people with underlying medical problems such as high blood pressure, heart or lung disease, diabetes, obesity, and cancer. You can argue that as a caring society, we should do everything that we can to protect the most vulnerable, even if this means that the rest of us must sacrifice some of our usual freedoms. Argument number 5. Limited ICU bed capacity. The fifth argument in favor of restrictions is that there's a limited number of intensive care unit beds. It's important to ensure that we do not have more people that need ICU than hospitals can accommodate. For many people, COVID-19 is something they can recover from if given ICU support. However, if you have COVID-19 when ICU is full and you cannot access skilled staff and equipment, then you could die of something that was preventable. At the beginning of the COVID-19 pandemic, there was a fear that hospital admissions for COVID-19 would outstrip hospital capacity, resulting in deaths that otherwise could have been prevented. There were two common responses to this concern. The first was to establish additional capacity. In the UK, the NHS built the Nightingale Hospitals, purpose-built field hospitals intended to treat critical care patients. The second common response was an attempt to slow down the spread of COVID-19 in order to slow down the growth of cases and reduce the burden on health services. This graph shows the weekly new hospital and ICU admissions per 100,000 population in the UK between the 8th of March and the 28th of June 2020. As you can see, there was a short peak in admissions and then a rapid fall in admissions. The national lockdown in the UK was implemented on the 26th of March 2020, and this graph is evidence that the national lockdown in the UK managed to flatten the curve of infections and prevent ICU beds from reaching capacity. Argument number 6. Measures aside from lockdown are hard to enforce. An argument in favor of lockdown specifically is that other measures to prevent the spread of COVID-19 are hard to enforce. A lockdown, such as a national lockdown, is easier to enforce than other measures, and the same rules apply to everyone. Imagine that instead of a lockdown for everyone, we did it in such a way that each person is allowed to go outside once per week or for 30 minutes each day. This would be a method of reducing contact between individuals without a total lockdown. Peru implemented a gender-based lockdown. The rules were as follows. Men could only leave home on Mondays, Wednesdays, and Fridays. Women could only leave on Tuesdays, Thursdays, and Saturdays. On Sundays, no one was allowed out. Unfortunately, this created massive issues for people who did not identify as male or female. Even if you used a different categorization like age or house number, you would still have the difficulty of enforcement. How would the police know who is allowed out or not? So the argument in favor of a lockdown is that any measure that is less enforceable, such as social distancing, is not likely to be respected. An example of this was in summer 2020 in the UK. The UK government had relaxed the national lockdown and implemented social distancing rules. Although many people did follow the rules, many people did not. You can see here a picture from the beach in the UK during the summer of 2020, in the middle of the COVID-19 pandemic. The beaches were packed, despite what the law was at the time. In summary, we've discussed a few arguments in favor of stricter measures of lockdown and social distancing as a response to the COVID-19 pandemic. As we said at the beginning of this video, you don't have to agree with these arguments, but it's important that you are aware of them. This is because it's crucial that you give a balanced answer when discussing hot topics in your interview. Many of the arguments we presented here have strong counter-arguments from those who feel stricter social distancing is not the solution, and we will explore those in our next lesson. Thank you for watching, and best of luck on your admissions.